So the Hushd Pro Avera comes with 5 arches, and the titration mechanism is fairly simple. There's a few ways that you can work the patient through this. One is the patient drives the titration through the Sleep Care app, and in there they walk through the recommendations only in the instance that you allow them to do so. Otherwise, if you're leading the change of their arches and the titration mechanism that we use for Avera, then we have a couple of places that you can refer to the progression. One is on the inside the packaging, inside the lid of the box, and it walks you through from left to right the different combinations. The arches come labeled with the 5 different arches, and so then you can use these labels and the dots on the side of the wings to be able to progress the patient through the different protrusive measurements. Our recommendation is starting the patient at upper 1, lower 1, and then from there, every 3 to 4 days, potentially up to a week, depending on the patient's comfort, move them to the next progression. So upper 1, lower 1, upper 1, lower 2, upper 1, lower 3, and then we go to the upper 2 and progress through lower 1, 2, and 3. So 6 possible combinations, and every time an advancement's made, it's another percentage of the patient's protrusive range through from their prescribed bite all the way through to their maximum protrusive range. If you're objectively titrating the patient, then obviously you have the data to be able to make your titrations based on the patient's efficacy. However, there is the consideration of the patient's comfort, and what our suggestion would be is that if the patient's no longer comfortable, then stopping for a period of time throughout that titration process can help the patient get comfortable. If you get the desired result with efficacy, no matter how far forward you've taken the patient, then that's generally a good indicator that we can stop moving the patient forward and stick on the combination that they're on.